Good afternoon, ladies and gentlemen, and welcome to today's webinar. I would like to remind you that this conference is being recorded. At this time, all participants are in a listen-only mode. For those connected by telephone requiring operator assistance during the call, please press *0. Web participants requiring support should use the chat feature on your screen. I would like to now turn the meeting over to your moderator, Jennifer Zellmer, President and CEO of CFHI. Please go ahead.
Thanks so much. And thank you to everyone for joining us today. We're delighted to be joined by people from so many places across the country. And I want to begin by acknowledging that we're meeting on land that has been inhabited by Indigenous people since the beginning. In particular, I acknowledge that I'm coming today from Ottawa, the traditional unceded territory of the Algonquin and Anishinaabe people. And we recognize and deeply appreciate their historic connections to this place and the sacrifices of those who've gone before. We also recognize and appreciate the rich tradition of sharing knowledge and of health and healing that has been so important for Indigenous peoples in many, many places. I'd also like to acknowledge that a virtual platform has many advantages. It's allowed so many of us to join together today, but that it also has disadvantages. So one of those is it's difficult to guarantee that everyone has a voice on today's webinar because we have hundreds registered today, but we want to include as many voices and people as possible. So please feel free to type into the chat box, introduce yourself to those on the line so that everybody knows who's here. And also, as you have questions, comments, or resources to share, please add them in the chat box at any time as well. Si vous voulez écouter aujourd'hui en français, veuillez regarder le numéro sur l'écran pour l'appel téléphonique en français. Merci. So today's Spotlight Series webinars is it's part of a series that is intended to raise the voices of Canada's healthcare improvers and innovators to shed light on some of the biggest challenges that we face and also to really share some of the leading practices that are coming forward, some of those points of light that may help to inspire all of us towards better care. My name is Jennifer Zellmer, and I have the great fortune to be the President and CEO of the Canadian Foundation for Healthcare Improvement. And I've come to this place through some complicated paths. In another time, in another place, you would probably say that my family on both sides has a nomadic tradition. My father's family were refugees from many different parts of Europe. My mother's family also moved quite a lot because her family was part of a military tradition. And so it turned out that I was born in Edmonton, which is Treaty 6 territory and the traditional home and meeting place of many different First Nations and Métis peoples. And I'm so lucky to have had the chance to have been born there and to have lived in many parts of this country. And we're equally joined by folks today who have interesting and wonderful histories. So, and I'm going to give them an opportunity to each introduce themselves. So, Marion, do you want to start us off?
Jennifer and crew, a thumbs up. All right. Well, thank you for the invitation to participate in the dialogue. I'm especially excited to be presenting with Kelly, my new best friend, who we just met, so thank you. I am broadcasting from Mohawk territory today in Tyendinaga country, so I truly respect the Mohawk peoples that have provided this space to me, and I'm looking at a lake right now and hoping you feel the calm waves coming to you from where I am. As Jennifer mentioned, my name is Marion Crow. I am a Cree woman. I come from Treaty 4 territory in Saskatchewan, and I recognize that I live, play, and work in unceded, unsurrendered Algonquin territory normally in Ottawa. But as you know, this pandemic has us working in unique circumstances, so I appreciate that we can join like this, mimicking the gathering of Indigenous people for centuries. I have the honor and privilege of being able to steward the First Nations Health Managers Association, as the founding executive director and now chief executive officer. I also have the pleasure of sitting as a board of governors for the Ottawa Hospital and as their vice chair of the quality committee and also an advisor with the Health Standards Organization. Thank you for having me, and I look forward to our dialogue today.
Thank you so much for joining us, Marian. And Kelly, you've added a new title of Marian's best friend, but you have many titles and traditions. Can I pass it over to you?
Can you hear me? I can't think of anything more honoring than to be Marian's new best friend. That's quite the accomplishment. Wawena Bojo, Wabananga Kikwe Indigenous Wabjishido Dem, Migma Anishinaabe Kwayan Dow, Dom Mugakadonjaba, Apading Made Kwayan Down. Hello everyone, I am so happy to be part of this conversation. I am coming to you from my home, which is in the traditional territory of the Three Fires Confederacy, the Anishinaabe Nation. I am on the territory that was traditionally held by my husband's First Nation, which is Chimnasing or Beausoleil First Nation. But this is not where my people come from. My people come from Dounguk, which is Newfoundland, particularly the west coast of Newfoundland. I have been working with mainstream organizations to help them be better at servicing Indigenous communities and Indigenous people for about 25 years now, and my focus in this conversation today is what we can do to help mainstream organizations in this amazing new reality that's been given to us to continue their work towards reconciliation, continue their work towards cultural safety and cultural humility, not humidity, you can say what my house is like today, sorry, and to make sure that those organizations that are truly looking to be better at servicing our Indigenous communities, that they have the backup and the support that they need. So I'm very, very honored to be part of this conversation. Chimigwech.
Thank you so much, Kelly. And I'm so delighted that you were able to join us, and delighted also that we're seeing introductions happening in the chat so we can see the broadening circle, which is fantastic as well. And really today is about having a conversation, about sharing learnings, because Kelly, Marian, you guys are both connected with so many different people across the country. I know you're hearing lots of things in this interesting but also challenging time. So to share some of what we're hearing, but also to broaden that conversation and share some of where there may be opportunities looking ahead as well. So maybe we can start with what have you been hearing? What have you been hearing about care in the time of COVID and culturally safe care in this context right now from First Nations? Marian, do you want to start us off? Oh, Marian, you're on mute.
How many times do we have to say that in the last couple of months? My apologies.
Okay.
I will take a little bit of time to tell you about the FNHMA journey around COVID-19. And my colleague Kelly is going to get into some of the practical pieces when it comes to really implementing cultural humility and safety in our collective organizations. So bear with me as I get through the journey. I do want to share that the First Nations Health Managers Association is a national nonprofit organization that leads to a First Nations credential called the Certified First Nations Health Manager designation. And we have 225 certified members across Canada. We work on professional development and providing networking opportunities for our fearless, tireless, and hardworking, committed leaders in First Nation health service delivery, and just a recognition of the outstanding work that they are doing right now to keep our nation safe during COVID-19. My hat's off to everybody here, and to them, I lift you up. Thank you. That's FNHMA. Our response to COVID-19 has been a couple of approaches. One, we had to recognize that we had a unique community that we could share information with. So we actually got on board right away at the end of March in terms of sharing messages and information that's credible, relevant, and applicable to the context and how service delivery is operated in First Nation communities. We started the FNHMA Town Hall series, and if I were standing at a podium, I would be looking out to say, how many of you have tuned in to an FNHMA Town Hall? If you haven't yet, please do so. We'll have some advertising a little bit later in terms of being able to provide how you can do that. But we invited Indigenous Services Canada right away, Dr. Valerie Gideon, who is the Senior Assistant Deputy Minister, to talk about the response to COVID-19. That looks at funding, that looks at PPE, it talks about the pandemic planning, how communities are responding and exercising sovereignty within their nations to respect that they are closing their nations to people who are not members to avoid the spread of COVID-19. The other piece that we've been doing outside of the town halls is a really fast response to recognizing and thanking all of the front lines that, as I mentioned, are keeping our nation safe. We did a public service announcement, aired on APTN television network, the radio stations that broadcast specifically to First Nation and Indigenous territories. And we partnered with the First Nation Information Governance Center, the Canadian Indigenous Nurses Association, Indigenous Physicians Association of Canada, the National Collaboration Center for Indigenous Health, of course, no strangers to CFHI, Thunderbird Partnership Foundation, and Carol Hopkins, and of course, First Peoples Wellness Circle, Dr. Brenda Ristool. And that's been part of the, I think, embedded pieces of how we live in community, and it's through partnerships and lifting each other up during times of need. So the partnerships became crucial in terms of the response. We started calling communities, directly picking up the phone to engage with what kinds of things do you need? Is there a message we can relay to your funders? Can we just be that voice on the other side of the phone that listens with an empathetic ear? Based on the town halls, we recognized that there were a lot of consistent questions, and the town halls are two-way dialogues. We have information that we present, and then we open up an inbox, and people can ask questions to the panelists that are participating every week. And so we saw a consistent theme and said, people are looking for information. How can we be responsive to the questions? And in that, Info Point was born. On May 11th, FNHMA launched a helpful desk, which people can call or email questions regarding COVID-19, and we will rapidly respond within 30 minutes with information that we have cultivated through partners, through general credible information sources like local health integration networks, regional health authorities. Of course, we would do nothing without Thunderbird Partnership Foundation and First Peoples Wellness Circle. So looking at it from the safety and wellness pieces of practice as well. And if you haven't seen them on a town hall, go back and watch their messages around resiliency and hope. This Info Point has been a huge success to date. We've poured blood, sweat, and tears, but it really continues the oral tradition in how we practice, how we connect with people. And so having a place that people could call was really important. And we've had calls around long-term care. We've had calls with respect to Is there Indigenous suppliers who are selling and distributing certified PPE? And just who would have thought PPE would be something we say every day now? It's just unbelievable how much the world has changed in the last couple of months. In terms of what else we're doing and have done as an organization, and I have to be so grateful and thankful to our board members who are all grassroots health leaders that live the values. Incorporating values into the organization is something you have to live. It's not words on paper and a policy. You have to embrace it. In every job description, we have the 10 core competencies that we look at when somebody wants to become certified with our organization. A piece of that competency is around the 7 teachings, the grandfather teachings. People call them different things from different territories, but really it's about how we conduct ourselves, and it's about humility, love, the teachings that guide us in who we are. We have those incorporated into our job descriptions, and we're measured in terms of performance with those indicators as well. The other piece is having incorporated wellness policies. If one of our staff want to reach out to a healer, go home to participate in a sweat, a ceremony, we actually give 5 days of paid leave for them to be able to participate in being grassroots, in being centered, in being holistic, and we call it our holistic wellness policy. I'm going to pause there and give an opportunity for Kelly to have some floor time as well, but I could talk forever, so I look forward to the other questions and sharing more about specific resources as well. So thank you so much, Jennifer.
Thanks so much, Marion. And I know we're just dipping our toe in the water to get started, but Kelly, please join us in the conversation. Can you talk a little bit about what you're hearing and what your journey has been over this last while?
I can, thank you. And thank you so much, Marion, for all of the hard work that you're doing. And it's amazing that there's such support going on for our communities who are really under siege right now. My world has changed a little bit. I was very busy. I travel across the country, and usually my work involves standing in front of a group of people, and that simply can't happen anymore because of the situation that we're in. And I think we went through a time of adjustment where everybody was saying, well, we'll just put it off until, we see how long this is going to take. And now people are understanding that, our reality may never go back to what it was. And so it's been difficult to incorporate a new way of doing the work that I do. But this works. This virtual platform works. CFHI is amazingly blessed with this technology and the staff to support this technology, and I can't think of a better forum to have this conversation. I'm doing more and more training online. I'm doing more and more shorter trainings, webinars, conversations, but it's difficult. I tell people it feels like I'm having a bath with my socks on, because although what comes out for me is the same, the feedback that I get is not the same. I can't see if people are laughing at my jokes. I can't see how they react. And so that's been a challenge. But as we've adapted to that, and as we've started to have these conversations again, and as I've been talking to my friends and family about their realities during COVID-19 from an Indigenous perspective, I'm hearing over and over again some of the same challenges that they're facing. Everyone is facing the same challenges within our environment today. Whether we come from whatever background, we're facing challenges. The issue for Indigenous people is that we are coming from a place quite often of inherited trauma. And the problem is that trauma is now being exacerbated by the realities that we are facing in this pandemic environment. Something as simple as wearing a face mask For people who were traumatized during residential schools or Indian day schools, to have their face covered can be incredibly triggering for them. So, during the debate of do we wear a mask, don't we wear a mask, will the mask work, won't it work, no one said what happens to those people who are triggered by past trauma when they put that mask on. Lineups, something as simple as a lineup and having to go in one direction around a grocery store feels very regimented. Again, really triggering for people who come from an environment where every move that they made was dictated by power and authority, and they had no choice to make their own decisions. So those things can be very triggering. The things that we all face, not being able to be with our loved ones if they're in care, if they're in long-term care facilities, if they have to go to the hospital. When I'm working with people, particularly in palliative care, and they say, what might we experience differently in trying to support an Indigenous family? And I tell them, expect everyone. Everyone is coming. It's not just, maybe a spouse and a child. It's all the cousins are coming, that we do things in community. And so that has been a real strength in our healing in coming through the trauma that we've all inherited in some way as Indigenous people, and that's been taken away from us just as the trauma gets worse again. So that's very difficult. The issue that Marion talked about, or how our communities are pulling in and sort of closing off in order to protect the members of that community, I applaud them completely and support them totally. But it doesn't come without a price. For some people who live on the reserve, my husband's community is an island, so it's a very good example of how you're not allowed to go into town to work. If you're going to live in the island, you're staying on the island. And that harkens back to the time when we were not allowed to walk down a road without, signed permission from an Indian agent. The pass system is not that far gone that we don't remember that. And now we're being told once again, stay here and don't move. We know it's for our own good. We celebrate that it's for our own good. Doesn't mean it's not a little triggering. Because we live off reserve, my husband doesn't have the opportunity to go home. He couldn't go home and talk to his mother at the gravesite when her birthday came around, which is something he does every year. I'm really missing the lilacs that bloom around the lighthouse on Christian Island and the connection with that history. My daughter can't put her feet on her traditional territory. And so those are the sorts of things that I'm hearing, not to say that we have it any worse than anyone else, but there are levels of awareness we have to have if we're going to make sure we're giving equitable support to Indigenous people by understanding those accumulated issues that may or may not be present with the rest of the population. I think I'll leave it there, Miigwech.
Thanks so much, Kelly. And just building on that, as you're talking about culturally safe context and how do we support cultural safety within the health sector in this time. And, I know, Marion, that this is something you and many of your colleagues have been thinking a lot about. Do you have thoughts on this front?
Absolutely, and thanks for the question, Jennifer. And Kelly, thank you so much for providing the context in terms of that historical trauma that we face. And, as our partners who have joined in on this call today start thinking about some of that historical trauma and what it means for somebody who is Indigenous to go into a mainstream organization, into the health system that isn't being operated in a First Nation community. I have a couple of thoughts on that. And one piece would be when we look at, for example, the FNHMA competencies and we talk about the 7 teachings, we also attach to that how cultural humility and cultural safety is really at the heart of all programming when you're looking at things from an Indigenous lens. What does this mean? And it doesn't matter. There are over 600 nations across Canada. We all have unique ways of talking, of exercising our sovereignty, of demonstrating our practices. They're so different. So there's never, one thing is there's never ever a pan-Indigenous way to move forward. It's going to be unique to the territory, their connection to the land, to colonization influences. I've been myself to a community where it was grounded in church. And I offered who I thought was an elder tobacco at the beginning of a meeting. And that's not how they practiced. But me, coming from southern Saskatchewan and thinking that was the right thing to do, was a major faux pas. I've recently participated in a Mohawk ceremony and backed out of the circle because they were going the wrong direction from how I practice. And right away they knew I was not a Mohawk woman. So there's just all of these nuances, and really it's about asking what is your cultural significance as it relates to that community. One thing I have always been appreciative of is the partnerships that we have as an organization. And I encourage you to reach out to your neighboring nations if you're in the mainstream health world to talk about what does culture look like for you? How do we incorporate into our organization's policies around smudging, if that's what that nation wants? Is there cedar brushing when somebody passes? Kelly, you mentioned we bring our whole family, aunties, cousins, adopted aunties, cousins, and we're all related. But that's who we are as people. So it's so important. And I have to really hold up CSHI as an organization. The partnership that we have is grounded in reciprocal respect and beneficial to both organizations. We didn't get here on an easy journey. We took time, we took steps, and we did it at the organization community pace. And that has been invaluable. Our boards have sat down together. We've broken bread together. And it's that commitment to get to know each other as organizations, as people, leading organizations. And I think, there's never a fast fix. It takes time, it takes respect, and a willingness to be uncomfortable in your learning. And I think that's when we learn the best. I look to some really important resources. Specifically, there's the, Megan from CFHI is sharing on the chat box, A Journey We Walk Together. If you have not already done so, check this out. It was done in partnership with FNHMA and CFHI to take a look at those beginning steps of how we look at embracing cultural humility, how do we implement it in our organizations, and again, it's the first step of a journey. We look forward to talking more about that in future work, about how we now go from putting them into policy to actually living those and engaging your Indigenous community within your organization. I have to say there's nothing worse for an Indigenous person than to have a settler educate on our history. Reach out to those Indigenous suppliers. There's also lived experience as well, and we appreciate that, but reach out to suppliers, especially right now during COVID-19. I have heard of so many innovative communities who are turning their maple syrup production companies into hand sanitizers. And the Canadian Council for Aboriginal Business has a list of suppliers who are certified, but be innovative in how you employ buying in an Indigenous world. We want to keep that economy going. We've also put an out-facing resource on indigenoushealthtoday.ca. So again, for those who are going to make a note, indigenoushealthtoday.ca. All the information, we have over 200 resources right now with respect to COVID-19 at FNHMA. we didn't want to be the owners. It's not our materials to share, so we parked it outside of our organization. If you have resources, reach out to them, put your resources there, share them with us, and we'd be more than happy to get that into the collective family of knowledge and of sharing. And I think that's a takeaway that we all need to do is break down the silos, pick up the phone, re-engage, get on a Zoom call, an Adobe Connect, whatever platform you're using, and have the conversation about how do we support each other not just as citizens, but in the fight against this pandemic and providing safety to everybody and keeping the Indigenous economy going. I said a lot, Jennifer. I'm sorry. You give a Cree woman a microphone and look what happens.
It's all good, although I have to say I miss being able to physically break bread together, Marian, but we'll find it again.
Well, and here's one more thought, Jennifer, before we go over to Kelly, is a reminder. It is Indigenous History Month. We're coming into the summer solstice. That's a day that you can tag for your organization to be committed in your journey to learning about the Canadian history, the landscape, why I say Cree, settler, Indigenous, Inuit. There's so many teachings. I know there's platforms that are available too, but pick that day, commit to it, and I think, learning is the best way we can move forward. And I would be remiss to not acknowledge that we are in a troubling time. I mean, I look down to the south and I'm saddened by what's happening, but it's not something new to Canadians. We think it is, but it's been happening to Indigenous peoples for as long as there have been people here outside of Indigenous ancestry. And so brown lives do matter. And let's pause and take a moment to acknowledge what's happening not just in the United States but around the world, and being a collective and committing to the truth and reconciliation calls to action, specifically around numbers 18 to 24 that talk about health. And so I implore you to revisit those and enjoy the journey of learning and sharing this beautiful Turtle Island.
Thanks so much, Marian. And like you, I think it is really important to acknowledge the multiple difficulties in this time, and the fact that many of those difficulties are long-standing. The pandemic in some cases has shone a light on some of those vulnerabilities and some of the gaps, and systemic racism as well. And we owe it to everyone to make that commitment to that learning. And if there's one of the things that does give me hope in this moment is the generosity of work like yours to share resources and learnings, and the fact that we're all participating today as part of that sharing and learning process. And Kelly, maybe I can, with that, hand it over to you also with a heart. We were practicing earlier and realized you have to watch the camera angle to make sure that you can actually get symbols into the picture frame, which you just did beautifully, Kelly. I wonder if I can hand it over to you, because I know that given your background in working with mainstream health organizations as well, you have a lot of thoughts about culturally safe care, cultural humility in this time.
So I think the biggest message I would have in that question of, what advice can I offer in the situation we find ourselves in today is don't stop. Wherever you are as an organization or an individual on the cultural competency continuum, don't stop. We understand that you're under extraordinary pressures right now, but earlier this morning, I guess it's afternoon, Marian mentioned holism. holism is embedded in an Indigenous way of being, that we don't separate our lives into bits and pieces, but that they are all intertwined and all part of the balance that we seek. And that's how you have to think of Indigenous issues within your organization, as part of the whole fabric of what you do, not as something that's just over here on a shelf that you pick up when you have the time and then put down when you don't. Indigenous issues and being responsive to Indigenous communities needs to be part of your COVID planning. It needs to be part of your changing your education support for your employees. It needs to be a part of everything that you do in this new environment, because it's a part of the world that we live in. So don't stop. Make it part of everything that you do. The other piece of advice I saw before we started in the chat box, that, or in the pre-poll, I think one of the participants said, I want to know more about how I can be better supportive of my clients or patients. I'm not sure which word was used. And I think, because we don't have time to do cultural competency right now, we're chatting about it. I think the piece of advice I want to leave with you is, do not be afraid to be wrong. It's too often we hide our actions, or we hide from taking a step forward because we're so afraid that we're going to be wrong. I'm wrong about 2,000 times a day. Never give a Mi'kmaq woman a mic either, Marion. So you're going to be wrong. No one starts this journey knowing everything. You're going to make mistakes. You don't need to apologize. I had a brilliant Facebook conversation with a friend who had posted something and said, we need to remember Black Canadians. We need to remember our First Nation Canadians. And I calmly corrected her and said, can I take this as a little teaching moment, and can I ask that you don't refer to us as our First Nations? You know, from our perspective, we find that rather demeaning and very colonial in its approach. The First Nations of Canada, or of Turtle Island, even better, but not to show some possessive. She never apologized to me for saying that. She said, thank you so much for letting me know. I'm going to change my post on Facebook. You're a never-ending source of information. That's a lovely way to be wrong. You don't have to feel bad to be wrong. You just have to acknowledge that there's more learning to do. And that learning comes through conversations. If your organization does not have resources for you, you need to start asking for that. There needs to be a place where you can call and speak with an elder or speak with an educator. There should be maybe an advisory circle of Indigenous people to support you. You need to talk to people who have been doing this work for a long time. You also need to talk to the rights holders. I am Kelly Brownbill. I have lots of experience to share, and trust me, you won't be able to shut me up. But I don't represent Indigenous communities. If you want to make sure that you are responding to the people who actually have permission or have been given the work of speaking for Indigenous communities, then those are the people you have to reach out to the AFN, to the PTOs, to the tribal councils, to the individual communities. Understand who it is that you are talking to, but you have to keep talking. I think some of the people that I work with right now are just looking for somebody on the other end of the line to put their minds at rest. I'm writing a memo that's going to go out to all of our partners, including our First Nations partners. How does this language sound to you? Just having that ability to ask that question of someone, anyone, takes so much pressure off of someone and so much guesswork out of the work. So develop relationships with organizations like Marion, develop relationships with our political organizations, develop relationships with trainers and providers of training. Marion also talked about the fact that there is no pan-Aboriginal approach to this work, that we are absolutely individual in our ways of being, in our ways of knowing, and in what we expect from service providers. There's not one answer across the whole country. So you need to be able to develop a relationship with those around you. If you are a local organization, then who are your partners? Probably you know about the First Nations that are in you or your catchment area or close, but you know about off-reserve organizations like Friendship Centers, Native Women's Associations, Métis locals. Are you reaching out to them as well? if you're looking to start the training process within this world of COVID, I remember that our story doesn't start at contact. It's so important that we talk about what was here before contact, so you can understand the journey that has been taken, and you can understand A, what was here, and B, what was taken away. Marion invited you to do that during Indigenous History Month, and when I hear Indigenous history, I get a little twitch because I went to public school way back when the Earth's crust was still cooling, and I was not taught history. I was taught someone's perspective on history, and a lot of it was just blatantly wrong. So make sure when you're looking for that history that you're not reading a history book that's 50 years old, because you're going to see inappropriate language, you're going to see inappropriate content, you're going to see the doctrine of discovery reinforced over and over and over again. When I'm working with clients, I'm constantly telling them, you need to partner with the people that you're going to be providing, but give me a minute and I'll get you ready to listen to them. Right? I don't tell anyone's story, but I prepare you to be able to hear what your Indigenous partners, sorry, I used your, but what the Indigenous partners in your region will be able to ask of you and talk with you. So the advice basically is don't stop. This is important that we keep this momentum going. Remember to be holistic, to think about these things not just on Indigenous History Day, but throughout the course of your planning as an organization. And make sure you're speaking with us. Make sure you're looking for resources. Make sure that you can pick up the phone and talk to Marion and say, this is what I've run across, or this is what's happening. Can you give me any suggestions? Miguel.
To add on to that, if I might, Jennifer.
Yeah, go ahead.
Thank you, Kelly, for reminding us about that rich history. I know when we had a quick mini chat yesterday, I knew that you would be talking about that history. And now I'll mention a point about the future and moving forward. It's so important to recognize that we often think about the 7 generations coming behind us as we develop. It's kind of an Indigenous value that we look at, is to always look at those are walking behind us in our footsteps. And when we think about programs and services, then we want to think about how that looks in the future as well. And just a note to remind folks, our youth are amazing. We had the Assembly of First Nations Youth Council on a former town hall, and I am so delighted that they are going to be tomorrow's leaders and are today leaders. So don't forget to think about them and their children and their grandchildren and their great-great-grandchildren. And so just, that perspective as well is always one that we want to think about. And always looking at all of the other, I don't like to use vulnerable populations, that's so wrong, but the populations, when I think about homelessness, and reaching out to the national friendship centers, whether that's, Odawa in Ottawa or the Regina Friendship Center, we have to remember that there's on and off communities. And we could not talk about engagement if we did not highlight that today is the 1-year anniversary of the release of the final report and 231 calls for justice of the National Inquiry into Missing and Murdered Women and Girls. And so I'll leave the thought there, and I'm excited to see what kind of questions we get from the audience of listeners and viewers. And hi.
Go ahead, Kelly.
May I jump in?
Absolutely.
We're going to bounce off each other a little bit. And thank you so much, Marion, for talking about those 7 generations coming. We need to think about both what we're inheriting and what we're leaving behind us when we go. In my culture, when we say Anishinaabe Kweyandao, when I say I am an Indigenous woman, that's never singular. It is impossible to say I am a woman singular, because just by declaring yourself to be that, you are including every single woman who walked before you right up until the end of time. They gather around me. My grandmothers gather around me every time I enter a space. But we also have to think about those generations that come after us. That's also part of our plurality, is that I have a responsibility moving forward to what I do today that will affect those 7 generations. And I know Marion said that, and the reason why I wanted to reiterate it is because that's one of the things to think about when you're doing cultural safety and cultural competency training. Remember that the past, that trauma that we've all spoken about today, is not necessarily your fault. I don't know who's on the call, so I'm not sure that who we have, but what I tell participants in my workshops is, you weren't running residential schools. You weren't scooping kids in the 60s. And so you have to acknowledge this history. You have to understand that it's a collective history, but you need to feel no blame for that history. You do have to own your actions today. And your silence, or your inability to learn, or your inability to do something with new knowledge, that's complicit to what happened before. So don't get hung up on feeling shame or blame. Understand what happened, and then have a look at, so what am I doing today? What am I doing to change the narrative moving forward? What am I leaving for those who are going to come and pick it up, those next 7 generations? Miigwech.
One final note, Jennifer. I know Kelly and I can
And then I'm going to slip in a question that somebody had, but go for it, Marion.
Here's an example of how you recognize those who walked before us. Anyone belonging to a professional association offers designations, certificates. Mark it number 2. We want number 1 always on that piece of paper to recognize those who have walked before us. And this beautiful background that I have, if you guys, I get so many comments on this on the town halls. This is a star blanket that was gifted to me in ceremony from Peguis First Nation. Peguis is so significant in my heart because it born Doris Bear, the first certified First Nation health manager in Canada, who has certificate designation number 2.
What a wonderful symbolic way of recognizing that breadth of experience and tradition and the path that we're all on as well. And so many people, Marion and Kelly, have been commenting in the chat about how much they appreciate the learnings that the teachings that you've shared, how much they're learning today. And one of the people who picked up actually on something, so I think we're actually bouncing around, which is amazing, the conversation also in the chat. So, I think Marion was maybe on some of the same wavelengths as you. So delighted, Ashley, that you were able to join us today from ITK. And Ashley began with thanking both of you, also highlighting that the 1-year anniversary today of the release of the final report and the calls for justice from the National Inquiry into Missing and Murdered Indigenous Women and Girls, and noted that the anniversary of the final report of the National Inquiry on June 3rd comes during a period of intense remembrance and reflection, with the final report of the Truth and Reconciliation Commission delivered 5 years ago on June 2nd. And the federal government's apology to survivors of residential schools delivered 12 years ago on June 11th. And also amid, as we've spoken about, the widespread protests in Canada and the U.S. calling for an end to racial injustice. And her question for both of you was, are either of you involved in doing any work to advance the work of implementing any of the calls for justice at a grassroots or at a national level with the development of the National Action Plan? Does either of you want to jump in? Marion?
We haven't, as an organization, been involved in the Justice Action Plan. However, we do look at the Truth and Reconciliation calls to action from a health perspective. So I apologize that we haven't picked up on the justice pieces, but we are definitely very keen in sharing specifically calls to action 18 to 24 that talk about health human resources and the ability and the need to implement hiring in the Indigenous workforce, especially if you have, I go back to the Ottawa Hospital and I think about how as an organization I'm proud to sit at that governor table. I have a chair that knows our Inuit partners in Ottawa very well because we have a lot of patients from Nunavut who get cancer care, and I think about our commitment in terms of having land acknowledgement, in terms of having a commitment to hiring Indigenous physicians, clinicians, all throughout the hospital, our smudge policy within the hospital, and reminding other like-minded organizations that they need to do and participate in those calls to action where they can. If it doesn't make sense to participate in justice, look at all of the other, the Truth and Reconciliation report, the RCAP report. There are so many reports that's endless, and you can pick up whatever's applicable to you and do your part by trying to engage and implement those actions.
Thanks, Marion. Kelly, anything you wanted to add?
Like Marion, I wasn't part of those two processes that Ashley mentioned. Incredibly respectful of the hard work that was done by so many, but like Marion, sort of picked up the work thereafter. So on a personal level, I married an Indian day school survivor who is a cycle breaker who went from addiction and poverty and suicide ideation and suicide attempts to being the traditional healer at the largest mental health center in Ontario. And he is at the point where he's, because the Indian day school settlement is happening right now, he's looking at opening boxes that have been shut for him for a long, long, long time. He's been clean and sober 38 years, and the reasons that he was never clean, that he wasn't clean and sober, are now being brought up to the forefront. I go into First Nations communities, and I do cultural competency work in First Nations communities, because sometimes we look at our own trauma so closely that we don't get to see a broader perspective. And when I talk almost the same presentation I do to mainstream organizations in a First Nation community, then lead them through how does that affect you? How does that affect your family? How does that affect your community? And how does that affect your nation? It's so valuable even for them to take that step back and look at that broad picture. So I feel humbly that my work started after that, where I could continue to talk about the calls for justice, about the calls to action with mainstream organizations, and I could continue to support Indigenous people in their journey through those pieces. Miigwech.
Thanks so much, Kelly. And the next question comes from Darlene at the North Bay Indigenous Hub. And Marion, this one is definitely to you. How do you get involved with FNHMA? How do you become a member? Oh, you're on mute, Marion.
Always. It had to be somebody, so I'm happy to do it. Darlene, thank you so much. I really appreciate North Bay Indigenous Hub asking this question. You can become a member. You can take our courses. We have workshops. We're going to make a huge announcement next week on our FNHMA Town Hall, so dial in. It's also on indigenoushealthtoday.ca or APTN Facebook, broadcast us live as well as FNHMA Facebook. But simply go onto our website, fnhma.ca, take a look at our programs that we offer. You can register to become a member and get access to a lot of rich resources. And if you want to start your journey, and as my colleague Kelly said, don't stop. Commit to learning. If it's the one thing we can all do, it's make that lifelong commitment to learning. Darlene, I'd love to see you at some point in the future participate in an FNHMA either education session or at some point becoming certified with our designation and coming out to the national conference when we are allowed to gather again and cross the stage where we celebrate and share in our rich knowledge and collective inherent wisdom.
And I can say from personal experience how absolutely wonderful a gathering the conference is. So everybody should try and be there when you can again, which obviously will come, just not quite yet. Now,
it will come. Stay tuned.
Absolutely. Absolutely. And we're looking forward to the teaser for next week, Marion. You've convinced us all, I'm sure, to join in. I'm conscious that we're coming towards the end of our time, but I did want to offer both of you an opportunity for some closing thoughts, something for us to take away, something maybe to provide even more of that hope that you spoke about. Kelly, do you want to start us off?
Sure. I want to say Chimigwech Welaliok, thank you so much for providing the Spotlight series so that these conversations could happen. Thank you so much for bringing cultural safety and cultural competency into a conversation that has been really focused on other things because of our new reality, and to not forget that this work has to continue. So I'm incredibly grateful for that opportunity. I think I want to encourage people. I said don't stop, but sometimes maybe it's don't not start. Maybe you're just starting your journey. You're not sure how you're going to accomplish that. Look at the resources that Marion has shared. Read the 94 calls to action from the TRC report. The report itself is huge. Even the executive summary could stop a truck. The 94 calls to action are a few pages. Everyone can invest that time. Read those. Have a look at them as real. There's a reason they're called calls to action. They're not called recommendations. They're calling us to action. So look at the ones that have to do with the healthcare. Is it 18 to 24, Marion? But also look as yourself as a citizen of the world and what your responsibility is to make the world a little better place and leave it a little bit better than you found it. Don't be afraid to start those hard conversations. Understand the journey is not going to be without potholes. It's not going to be without speed bumps. And that's when we need to be truly dedicated to this work, is when something goes wrong, when things kind of come off the rails. And that's when we need people committed to moving forward and continuing this good work. I am incredibly grateful that there are so many people, Indigenous and non-Indigenous, who are waking up to the fact that there have been huge inequities in our healthcare system for generations, and they're not going to take that anymore. And it's hard to do, and I so appreciate their efforts. So Chimigwech for allowing me to be part of this conversation, introducing me to my new best friend. And I will be writing a blog about this process to wrap it up in a ball, put a big bow on it, look at your comments in the chat box, answer any questions that maybe didn't have time. So look for that coming from CFHI so this conversation can continue a little bit thereafter, and that might be helpful for some of you as well. Miigwech, Jennifer.
Thanks so much, Kelly. And Marion, Kelly's new best friend, closing thought?
Well, it's so hard to follow Kelly. Kelly, I love that. Don't not start. Like, how can we not keep going and get started? And learning is a lifetime journey. I really want to inspire you to have hope. Hope that we can collectively make tomorrow a better place where we feel inclusive, valued, safe, and that's all of our collective responsibility, is to have accessible, equitable health services for everyone, no matter what color, creed, race, gender, whatever that looks like for you. May you be welcomed with open arms into the healthcare system, and you can feel like you are in a safe place, in a blanket of hugs and love that looks at you as a whole. All of your history behind you, where you are now, and where you're going to be tomorrow. Hi.
Thank you so much, and I know I speak for everyone on this call in sending both of you huge thank yous for what you have shared today and for the work that you do, and also in recognizing the support and resources that people have been typing into the chat to broaden the conversation as well and continue, as Kelly said, with a blog so that we both don't not start and also don't stop so that we can continue that conversation too. And also just to close, an absolute recognition, lift up and thank you to everyone who is working so hard in both this time and in the times before and the times to come to carry on this work. Thank you so much, everyone, and enjoy the rest of your morning if you're in BC, afternoon to evening as you go across the country. Thank you again.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.